Hello and welcome to the EMS on AIR Podcast. The mission of this podcast is to keep healthcare providers safe, informed, and prepared. Today is February 23, 2021. This episode was recorded on February 8. I'm Jeff Lassers and I'll be your host. Even though we are located in Southeast Michigan and we mention our home state a lot, today's content applies to EMS on the national and even the global scale. In Season 2, Episode 12, we interviewed Jennifer Combs, a nurse practitioner from Healthy Mothers, Healthy Babies Coalition of Broward County, Florida, and Captain James Carroll from Fort Lauderdale Fire Rescue. These two fantastic people have been teamed up for about the last decade to create and grow the Direct On-Scene Education Program, more commonly called DOSE. DOSE is an innovative attempt at eliminating sleep-related infant deaths due to suffocation, strangulation, or positional asphyxia by using first responders to proactively identify and remove hazards while delivering education on scene. First responders are trained to identify and remove these hazards from an infant's sleep space while on scene during emergency and non-emergency 911 calls. During that episode, Jennifer and Jimmy revealed some startling statistics that really opened my eyes. Every year in the United States, there are about 3,600 sudden unexpected infant deaths, or SUIDs. These deaths include infants less than 1 year old with no immediate obvious cause. There are three most common reported types of SUID. The first is Sudden Infant Death Syndrome, or SIDS, which is a term we're all familiar with. About 1,600 infants died of SIDS in 2017. The second includes approximately 1,300 deaths each year from truly unknown causes. The third most common type of SUID is accidental suffocation and strangulation in bed. These preventable sleep-related situations account for about 900 infant deaths each year. Here's a fun fact about the county where I live and work. Between 2010 and 2017, there were 77 sleep-related infant deaths in Oakland County, Michigan. Too many, especially when I learned that these are preventable deaths. In our last episode, we sat down with Dr. Sam Mishra and Terry Godey from the state of Michigan to talk about how EMS in Michigan, just like any EMS systems in any other state or country, can easily and painlessly adopt and implement DOSE. During that episode, we looked at the potential impact from a statewide perspective and showed how Michigan, for example, is leveraging its various EMS systems to decrease the total number of preventable infant sleep-related deaths. However, the state can't do it alone. No state can. They need help from the experts and resources at the local levels, and that's where today's guests come in. In this episode, we welcome Dave Roth and Samantha DeMont. Dave is the Oakland County Public Health Nursing Supervisor, as well as the Health Division's Safe Sleep Coordinator and the Coordinator for the Fetal and Infant Mortality Review, or FIMR. Samantha is an Oakland County public health nurse and FIMR parent interviewer. Dave and Samantha have tough jobs as they are all too familiar with infant mortality and preventable infant sleep-related deaths. Part of their job is to know the incidence, occurrences, and circumstances of infant deaths in Oakland County, Michigan. They are most familiar with our local data, so it makes sense to bring them into the fold to help guide us towards understanding the problem in our own backyard. Understanding the problem helps us appreciate what we can do to solve it. This is vitally important. Today, Dave and Sam will lend their expertise and data to help us appreciate what is at stake for newborns sleeping in unsafe situations. Then they'll describe what Oakland County Health is doing to limit preventable infant deaths in Oakland County, Michigan. We'll finish off our discussion by describing how Oakland County Health is helping to implement DOSE into as many EMS agencies and systems as possible. Before we introduce our guests, I just want to say one thing from the last episode that bears repeating. DOSE doesn't just prevent infant sleep-related deaths. It prevents parents, caregivers, and EMS providers from the experience as well. As first responders, we see and go through enough hard stuff, and DOSE is one of the ways to limit the number of bad experiences that we might be exposed to. So if you adopt DOSE at your agency, you're not just saving babies. You might be saving your coworkers, future EMS providers, and maybe even yourself from the experience of running on an infant sleep-related death by eliminating the problem before it happens. Prevention works. Let's save some babies. To learn more about how you can implement DOSE or to obtain more information, go to their website, doseprogram.com. That's DOSE program.com. And you can find our guests' contact info in the episode description. Please keep emailing your questions, comments, feedback, and episode ideas to the EMS On Air podcast team by email at qi@ocmca.org. Also, check out our updated website, emsonair.com, for the latest information, podcast episodes, and other details. Follow us on Instagram at EMS On Air, and please, whatever podcast platform you use, subscribe to our podcast and leave us a rating and a review. It really helps us to grow this thing. Thank you, and enjoy the episode. Good morning, guys. How are we this day?
Good.
Fantastic. We're going to start with you, Dave. Can you let everybody know who you are, what you do, and where you do it?
I'm Dave Roth. I'm a registered nurse with a doctorate in international public health. I am a public health nursing supervisor at the Oakland County Health Division. So I oversee a group of nurses that visit pregnant moms and follow their babies for up to 1 year old. I'm also the Oakland County Fetal and Infant Mortality Review Coordinator, and I'm the Oakland County Health Division Safe Sleep Coordinator. And I do all of that in Oakland County, Michigan.
Super cool. So you know our buddy Russell Faust?
Yes.
He's our guy. We like him. Samantha DeMont, can you let everybody know who you are, what you do, and where you do it?
Sure. I am Samantha DeMont. I'm a registered nurse. I'm a public health nurse here in Oakland County and work with Dave. I do community nursing, which I go out into the field and visit with pregnant women and families that have babies anywhere between birth and up to 3 years. And we talk about education, nutrition, growth and development. And for FIMR, I'm also the Oakland County FIMR parent interviewer. So when we have a baby under a year old die in Oakland County, I reach out to those families and I see how they're doing, if they need any kind of resources, grief counseling or any other kind of resources. And I just give them an opportunity to talk about the pregnancy, the birth, delivery, any complications, get their side of what happened, give them a chance to just tell their story of their child.
That's great that you do that, but it's really tough that it has to happen, right?
Absolutely.
So you said you were a FIMR parent interviewer. Can you give everybody that acronym, FIMR? Can you break that down for them?
That is the Fetal Infant Mortality Review. And Dave and I are on the FIMR team along with my colleague Ann Ronk. She's also a registered nurse. She's our FIMR nurse abstractor. She goes into the hospitals and gets birth and death records, and she gets the medical autopsies, gets all the data. She gets the facts, and then I get the emotional side of what happened directly from the parents.
Yeah, the account directly from the parents is really tough. Digging through data is really tough, but man, talking to people is even tougher.
The FIMR process involves 2 steps. We investigate the case and we bring a group of medical, social, and community members to discuss the case anonymously to come up with recommendations on how this death could have been prevented or how things could have been done differently. And then we have a community action team, which in Oakland County is the Best Start for Babies. And they meet every 2 months to come up with concrete recommendations on how these deaths of children less than 1 may be prevented.
So it sounds like the spirit of your team is to identify data that clearly demonstrates the problem, and then to talk to people that were involved with the problem to identify how could anything have been prevented, and then putting people as assets out there to prevent the problem. Is that kind of safe to say, to summarize what the team's mission is regarding FIMR?
Yes.
Okay, cool. So in previous episodes, we had the pleasure of bringing on Jennifer and Jimmy from Broward County, Florida. They have done a great job of creating the Direct On-Scene Education Program, also known as DOSE. And that all started based on what I learned from them was there's all these statistics about SUID, sudden unexpected infant death. Now, when I was going through EMS school, we talked about SIDS. We never talked about SUID. I wasn't aware that SUID's really broken down into 3 different things. And that's SIDS, as we really know it classically, and then unknown causes that are really just, you can't really account for anything. And then accidental suffocation and strangulation in bed or sleep-related deaths. Things that could have been prevented. we really had a good idea of how the country's being affected by this. And then I talked to the state of Michigan EMS for Children coordinator, Dr. Sam Mishra, and our EMS education coordinator, Terry Godey, who's befriended the people from DOSE and bringing DOSE into Michigan. And they gave me an idea of what's really going on in Michigan. But give me a scale of the problem as it currently is in Oakland County, Michigan.
I'm going to present a couple sets of data. The first set is between 2010 and 2017, and that's official data from the state. And then I'll talk about some unofficial data from Oakland County. So the official data from the state shows that Oakland County between 2010 and 2017 had an overall sleep-related infant death per 1,000 births of 0.7. So that's a low number, one of the lower numbers in the state. The state average was 1.3 deaths per 1,000 live births. But if we look at Pontiac and Southfield specifically during this time period, 2010 to 2017, we had a death rate of 1.9. So it's almost triple what the average rate in the county is. And that is basically related to race and social determinants of health. From 2018 to 2020, we've had 0 deaths related to SIDS. We've had 2 sleep-related deaths with an unknown cause, where the child was found dead in bed, but they're not sure why that child died. And then we had 26 sleep-related deaths. And again, the last 3 numbers I presented to you are not official data from the state. These are just related to some death certificates that we have.
The 26 over the last 3 years, one thing that we have noticed is in the last roughly year and a half, we've seen 1 a month. It's been more recent.
Have you seen an uptick since 2020's introduction to COVID?
Well, we had 10, and the year before that we had 10. Yes, I would say the causes are possibly a little bit different. We have more dads involved in the sleep-related deaths, more substance abuse related, where the parent may have been intoxicated with alcohol or prescription medication.
Okay. Yeah, the reason I ask about the COVID one is because the changing conditions, although people are home more and the babies probably aren't getting COVID, people are suffering more socioeconomically in these areas sometimes. And that doesn't make their sleeping conditions better. So I was more curious of, and it sounds like it's not really shown up in the data yet that you currently have available to you. So it'll be interesting because I know in Oakland County, Michigan, is many places that had a red wave of COVID go through their area. We saw the cardiac arrests in general go way up, or the deceased on scene patients go way up for various reasons, not just from COVID, but for various reasons. So it sounds like the data hasn't shown any impact there. But when we look at the state of Michigan, you're saying that there's specific target areas in Michigan that are suffering from a little bit more of these numbers than others. And a lot of that, where I've said before, is where I work, we have a lot of people in their retired years, let's call it. We don't have a lot of babies. If I see a baby where I work, it's probably just in the community, not as a patient. That's not always true for other places that have a much younger community, like Pontiac and Southfield. There's a lot of babies born in those communities. So they're obviously going to have more problems lying in wait. So can you kind of compare and contrast the number of deaths you said in the last few years is 26? However many different townships and cities there are in this county, where can you really stratify those? Where are those happening?
Actually, they're happening all over the county. There does not seem to be a major socioeconomic difference in the areas that it's happening. We've had parents who are very well-educated professionals have their child die, and we've also had average Joe on the street.
So there's really no trend to that specifically, because we're talking about sleep-related deaths, which may be literally in the arms of the parent as they fell asleep and then essentially leaned on the baby and then didn't allow them to breathe. Sam, go ahead.
I do notice just over the last year with COVID, while we do see some in those more affluent areas, I think we've seen quite a fair amount in the areas where maybe people don't have as much space in their home, that they're bringing the baby in the bed with them, places where people have more, maybe hit harder more economically lately, that they're putting babies either in the adult's bed or in swings, places that are not really intended for babies to sleep.
So that people are making do, and that's causing additional problems that could be happening. That's tough. That's real tough because people are just trying to make it work right now. You know, I remember driving in the back of a station wagon on that little bench thing with like basically a rope holding me down. I don't think that was recommended either, but we survived. And that's sometimes what you think of, like, we just got to make it work right now. And sometimes those situations lend themselves to catastrophe. Now that we know the catastrophe that does occur in Oakland County, Michigan, can you guys discuss how Oakland County Health is doing their best to limit preventable infant deaths in Oakland County currently?
So that's one of the things that we are seeing, especially it's harder right now to get in touch with people, to give them the education that they might be putting their baby in an unsafe situation. They may not realize it. We do know that a lot of people believe that they know about safe sleep, but it goes beyond just putting baby on their back. And so we have been modifying our home visits that we would normally go out to the home and talk to them about safe sleep and talk to them, look at their sleep area for their baby, look at that and talk about ways that they can make it safer. We've been doing our Zoom visits with our families and asking if they're willing, they can show us where baby sleeps. Sometimes we are talking to the families and we see right there on the video that baby is sleeping on the couch or sleeping on the bouncer chair. We are doing more outreach with the community, that we are trying to partner with other organizations, and we're trying to make sure that anyone that comes in contact with a family that has a baby can bring up, you know, I see your baby sleeping. Do you ever worry that they might stop breathing if their neck is forward or something like that? Just get everybody to have a conversation about safe sleep. And my situation as the parent interviewer for FIMR, one of the questions that I always ask families, if they're willing to talk, I will ask them, what would you like other families to know? What would you like to say to other parents or future parents that are out there? And some of the things that people have told me have really hit home. Some of the things have struck me and I'll never forget. I spoke to a woman. She had always shared a bed with both of her children, and her baby was older, about somewhere between 6 and 12 months old. And it just takes one time. She said, "You are not invincible." And I had another family that their baby was in a sleep position device. And I asked them, what would you like other families to know? And it was really, they almost peer pressure, that they had so many people, everyone they knew had used this particular sleep positioning device, and everyone talked about how much they loved it. And the packaging even says that it's not intended to be used for long-term sleep. And they went with what their friends in their community said about how much that everyone loved this device. So their comment to tell everybody else was to not use sleep positioners when they're putting the babies to sleep. There was another family that had some friends over, had some drinks and a little bit of partying, and normally put the baby in his own bed, put the baby in the crib by themselves. And this one time they were tired. They just, whatever reason, brought the baby in their bed, and that was the night that he died. And their words were, it only takes one time. Talking to a lot of families when I'm doing education for home visits, people that still have their baby, it can be hard because everybody kind of has this idea of they know about safe sleep, or that it's not going to happen to them. And that statistic where it's between 1 and 2 in 1,000, that's going to be somebody else. That's not going to be me. And so I do like to remind people that accidents are never planned. That's the whole nature of an accident. So just trying to help people have that safest environment that they can.
We find that most people have heard of safe sleep, but it's not easy to follow the safe sleep recommendations. Like when you're very tired at 3 o'clock in the morning and you have to get up at 6 o'clock and your baby won't stop crying, you may want to bring them to bed. So people know the rules, the regulations, recommendations, but they are hard to follow. So we try and reinforce the message. And as Samantha was saying, most people think it will not happen to them.
Yeah, and that's the nature of an accident. You don't see it coming. All you can do is kind of hope to plan for the future. And I know the devices, I think you're kind of generalizing, is these babies lay in them. They're not breathable materials. If they were to roll, there's all sorts of things. Now, I'm very aware of these things because I have a 2-year-old. Well, she's going on 2.5, and she's got a baby sister on the way who is due in March. So little Sophia's coming, and you guys, every time I talk to either you guys or the state, you freak me out. And then me and the wife end up on Google making sure that we're having no devices in the house that could potentially cause a problem. What's really interesting is even though it says it blatantly on all the packaging, and this is to kind of speak to your point, Dave, it makes it even harder when the packaging says don't sleep in it. But then you go look for a used one of these devices that are very expensive, and all the parents are raving about how their kids sleep in it. And you're like, wait a minute. So I could totally say, as a paramedic who's very attuned to what's going on with the infant safe sleep stuff, I look at that as ridiculous. But it's somebody who's, just some person who does something not in the medical world, doesn't have any idea what's going on. They'd be like, look at this cool thing. That looks really convenient. And they don't take the time to look at the packaging because, like you said, all their friends, all their family uses it. That's tough. That's a really tough situation, and it doesn't prevent the problem and only keeps it going.
Just talking about going out to find something like a used product, that's something that we definitely encounter because we have people that are often very low income and they may be using something that was donated from a friend or a family member. It might be something that has since been recalled. And we know that, like with the recall a couple of years ago of the Rock and Plays, there was a whole secret market resale of those because people loved them. And one of the issues too is they're small. A lot of these people don't have space for a crib in either a separate room or even in their own room. We work with agencies. We try to help them get resources. If there's anybody that needs resources, they can call our nurse on call. That number is 800-848-5533. If they live in Oakland County and they're needing help finding anything for their baby, our nurse on call line can help put them in touch with someone that can either help them get a crib or the play yards with the bassinets, anything that would be safer than a recalled product. And then they can also put them in touch with a home visiting nurse if that's something that families are in need of.
I do have a question about the home visiting nurse in these situations because it brings up a potential mistrust that somebody's coming into their home. They may feel judged. They're looking for the right answer. They want to do the right thing, but that can be kind of intimidating, I think, to a new parent, especially a new mom who may be hard to making ends meet, which may create the need to have a much smaller place to sleep or co-sleep with the baby. So how do you get past that conversation? How do you get people to open up in that situation before the problem happens?
Sure. Completely voluntary program. So that is one thing we always tell people, that if it's not something that they feel is working out for them, they can always cancel it. We try to have open conversations. I go in and say, what are you most interested in learning about right now? Whether it's need of resources or if it's general education, what is it that you're looking for that I can provide? And then I try to bring in conversations like most people don't say, oh, I really want to know all the ways that I'm putting my baby at risk by putting them to sleep. So if I'm in the home and maybe I see baby sleeping in the bouncer, sleeping in the car seat. It's so nice that he sleeps so easily. Do you find it hard to move him into his bed, or does he sleep there regularly? Do you put him in another place for sleep? I ask questions like, how hard is it for you to put your baby to sleep? And then we'll talk about, did you know that if a baby is sleeping on their stomach, they can be at an increased risk for choking? And we talk about the different things. I'll ask, what do you already know about safe sleep? A lot of parents, they know baby sleeps on the back, but that's kind of the limit of their knowledge. So
it seems like you're doing a lot of direct on-scene education, and that you're in the same spirit of how we got there. You go into people's homes that, they called you and said, please come into my home. And you're kind of analyzing a situation. There's a various spectrum of things you're already in there for, right? Same thing for me, except for mine's probably more specific. Their house is on fire if they called me, or somebody in their house or around their house is having a medical emergency. And while I'm there, I tend to go, hey, that situation you have there, that could be a potential problem. Now, that might be a fire hazard. It might be a health risk, or it might be a sleep hazard for that baby. So I think Oakland County Health, as I'm hearing it, is basically doing the same thing that Broward County is doing. All we are trying to do with all our different organizations is bring all that together, identify what's working, because you're already walking into people's houses in my backyard. And I think as an EMS provider, that's very valuable to me to go, hey, what's working in your backyard or our backyard, so that when I'm there, I can pick up on where you left off, or I can pick up on the good habits that you had, or maybe get around some obstacles, like starting with opening questions, those conversation starter questions of, hey, so that's a really cool thing. So how do you transition when they fall asleep to get into the bed where they're safer? Rather than, you shouldn't sleep in there. What a better way to do that? So I think Oakland County EMS agency's plans to adopt DOSE in conjunction with the state of Michigan could only be reinforced by working with our local county health, with you guys, because it sounds like you have the data, you have the experience, you have the know-how, and we can only help each other in that regard.
Yes, and I think this is going to be a great partnership, because we know that we may do a home visit with mom, but when mom goes to work, grandma or someone else is taking care of that baby. And so having you go out, and you may see that grandma's got a crib or grandma's got a car seat in the house, and you can provide that education to her as well.
Absolutely. And it gets us all on the same page. Dave, what do you think?
Yes, that's absolutely the idea why we want to collaborate with you. We've got to keep a consistent message out there each and every time, just to reinforce it.
That is all for the show today, everyone. Thank you for listening. Thank you to Dave and Samantha for coming on and spreading your knowledge. Your time and participation is always appreciated and never wasted. To learn more about how you can implement DOSE or obtain more information, go to their website, doseprogram.com, and you can find Dave and Samantha's contact information in the episode description. Please keep emailing your questions, comments, feedback, and episode ideas to the EMS On Air podcast team by email at qi@ocmca.org, and check out our website, emsonair.com, for the latest information, podcast episodes, and other details. Follow us on Instagram at EMS On Air, and please, whatever podcast platform you use, subscribe to our podcast and leave us a rating and a review, because it really helps us to grow this thing. Thank you for listening to the EMS On Air podcast. Stay safe and have a great day.